Hey, Dr. Steve here. You know, a lot of patients, or sometimes people who are about to become patients, want to know, hey, what are you going to do when I come in? How are you going to examine me? And that's why we're doing this video. It's about an 8-minute long video or so, and I'm going to kind of go through what we do with probably 95 or more greater percent of the patients that come in. So, as you probably already know, you live your life through your nervous system. Your nervous system is the master control system of the body. It's the most important system. And so therefore, I want to know how healthy it is. And that way I can convey it to you. So I'm going to do a couple of different tests today to show you what we do with most people. Okay? The first one is called thermography. Thermography has been around for about over 100 years, and back in 1988, a group of neurosurgeons at Johns Hopkins were able to determine that it can actually test how well the sympathetic nervous system is doing. So we're going to go ahead and do this one first.
Begin scanning.
We're going to turn you this way. It's as easy as this. We start down low.
Begin scanning.
Great. So that's thermography. The next test is surface EMG.
C3.
Perfectly painless. No pain whatsoever.
C7. T4. T8. L4.
So that was the two tests, thermography and then surface EMG. So here's what we know when I do this test. When it comes to thermography, we know that when it comes to looking at the nerve that comes out of the spine, any nerve, whether it's the one down here in your low back or one that comes out of your neck, it does 3 different things right here. It has a sensory component, a motor component, and an autonomic component. Now, the sensory component is the one that tells you about pain and posture, and so that's what some people tend to come in with. They have low back pain or neck pain, and so that's your sensory nervous system talking to you. And then we have your motor nervous system, which controls the muscles, okay? So it tells us of things like weakness, spasm, fatigue, and tightness. And then we have the autonomic nervous system, which controls blood vessels, organs, and glands. And that will tell us things like sinus and allergies, low energy, digestive problems, breathing problems. So all 3 of these come out of each nerve that comes out of your spine. So, something to know here is that your sensory nervous system, which detects posture and pain, is only about 10% of your nervous system. So the other 90% controls the muscles and the blood vessels, organs, and glands. So when patients come in pain and posture, while we are concerned and we want you to definitely feel better and lead a much more productive life, I'm more interested in the 90% of your nervous system. And so when we do the thermography tells us about your autonomic nervous system, again, blood vessels, organs, and glands, which was the first test that we did right here. And so we go over those results with you and show you which organs, glands, and blood vessels may be receiving inadequate amounts of nerve impulse or where there is nerve disturbance. And then the second test is the surface EMG for the motor nervous system, which controls the muscles, which is this one right here. And then we can actually discuss with you the levels at which there is nerve disturbance and muscle tension, spasm, weakness, fatigue, and what we can offer you as far as doing something about that and helping you to lead a more productive life so that your ability to work is better, you have more focus, so that you can sleep and rest better, and you can enjoy life and your family so much better. I hope you enjoyed this and look forward to seeing you. Thanks.